In a world where our well-being is directly tied to the silent functioning of vital organs, the liver stands out as an unsung hero. When it starts to fail, it's not just physical signs that alert us. Our mental functions and mood also come into play, completely transforming how we interact with the world around us. But how would you identify the signs that something is amiss with your liver before it's too late? Like and subscribe to our channel. Each like and subscription helps us bring you more quality health content. Your participation makes the difference. The liver is one of the most vital and multifunctional organs in the human body, responsible for a wide range of essential functions that sustain life and overall health. One of its main functions is detoxifying the blood, removing harmful substances that are ingested or produced by the body. Additionally, the liver plays a crucial role in nutrient metabolism, storing vitamins and minerals and transforming nutrients from food into usable energy. It is also essential in producing important proteins for blood clotting and other biological functions, demonstrating its centrality in maintaining bodily homeostasis. Having a healthy liver means keeping these functions operating efficiently, which is essential for maintaining overall health. When the liver is diseased, these functions can be impaired, leading to serious conditions such as jaundice, toxin accumulation in the body, metabolic issues, and even liver failure. The risks associated with a compromised liver include not only physical deterioration, but also significant impacts on quality of life, highlighting the need for prevention through a balanced diet, regular exercise, and avoiding excessive alcohol consumption and toxic substances. Therefore, understanding and caring for liver health is crucial to prevent these risks and promote a long and healthy life. Jaundice is a medical condition characterized by the yellowing of the skin, mucous membranes, and the whites of the eyes, known as the sclera. This notable symptom is caused by the accumulation of bilirubin, a byproduct of normal blood cell metabolism in the blood. Typically, it is the liver's function to process bilirubin, converting it into a form that can be eliminated from the body through bile. However, when the liver is damaged or ill, whether from infections, chronic liver diseases like cirrhosis, or blockages in the bile ducts, it can fail to process and properly eliminate this compound, resulting in jaundice. Identifying the early signs of jaundice is crucial for the early diagnosis and effective treatment of underlying liver issues. The change in coloration can be subtle initially, starting with a slight yellowish hue in the eyes that is often easier to notice in natural light. As bilirubin levels increase, the skin may also begin to show a yellowish tone, starting at the extremities and spreading to other parts of the body. In addition to visible changes, symptoms such as fatigue, abdominal pain, and dark urine may accompany jaundice, indicating more severe liver issues that require immediate medical attention. Liver problems can have a direct and visible impact on the color of urine, serving as an important indicator of liver dysfunction. When the liver is compromised, its ability to process and eliminate substances like bilirubin is affected. Normally, processed bilirubin is excreted in the bile and helps to give feces their characteristic brown color. However, if the liver cannot process bilirubin sufficiently, the excess can be reabsorbed into the blood and filtered by the kidneys, which then excrete it in the urine, making it noticeably darker. This phenomenon, often referred to as tea or cola-colored urine, is a strong indication that something is wrong with the liver or bile. In addition to the change in color to a darker shade, other signs in the urine can indicate liver problems. For example, the presence of foam can suggest that the urine contains excess proteins, a condition that can also be related to liver dysfunctions. It is important to be aware of these changes and consult them with a doctor, especially if accompanied by other symptoms such as jaundice, abdominal pain, loss of appetite, and general fatigue. Monitoring these signs can be crucial for the early diagnosis and effective treatment of liver diseases, preventing more serious complications and promoting long-term liver health. The color of feces is a significant indicator of liver health, reflecting directly the functionality of this essential organ. Normally, feces acquire their characteristic brown color due to the presence of stercobilinogen, a byproduct of bilirubin processed by the liver and excreted in the bile. However, when the liver is functioning suboptimally due to diseases such as hepatitis, cirrhosis, or biliary obstructions, its ability to metabolize and excrete bilirubin is compromised. This can result in a significant reduction in bilirubin reaching the intestine, leading to discolored or pale stools. This change in coloration, often described as clay-colored or gray stools, is a warning sign that the biliary system is not functioning properly. The causes behind changes in stool color can vary from relatively benign conditions to situations that require urgent medical attention. In addition to liver problems, obstructions in the bile ducts, such as gallstones or tumors, can prevent the normal flow of bile, thus affecting the coloration of feces. Severe infections, such as viral hepatitis, can also damage the liver to the point of altering bilirubin production and excretion. Therefore, regularly observing stool color is crucial. Persistent changes in coloration should be consulted with a health professional for proper diagnosis and treatment, avoiding more serious damage to the liver and maintaining overall health. Abdominal pain and swelling are common symptoms that can be directly associated with liver problems. The pain related to the liver usually manifests in the upper right quadrant of the abdomen or just below the ribs and can radiate to the back or right shoulder. This pain can range from mild discomfort to an intense and persistent sensation, especially in cases of liver inflammation, such as hepatitis or more serious conditions such as cirrhosis and liver cancer. The presence of pain in this specific area, along with other symptoms such as jaundice and changes in the coloration of urine and feces, can indicate a liver condition that requires immediate medical evaluation. Abdominal swelling, or ascites associated with liver problems, occurs when there is an accumulation of fluid in the abdominal cavity, a common complication of advanced liver diseases such as cirrhosis. Unlike common swelling that can be caused by issues such as indigestion or hormonal variations, swelling related to the liver is often accompanied by rapid weight gain, an increase in abdominal circumference, and may present a tense and shiny appearance of the skin over the affected area. This type of swelling can be a sign of portal hypertension, a condition where the blood pressure in the veins of the liver becomes abnormally high due to liver damage. It is essential that such a symptom be evaluated by a health professional, as it may indicate significant deterioration of liver function. Chronic fatigue is a common symptom, but often overlooked, of liver dysfunction. The liver plays a crucial role in regulating chemicals and purifying the blood, as well as being responsible for the metabolism of essential nutrients for energy production. When the liver is compromised due to diseases such as hepatitis, cirrhosis, or fatty liver, its ability to perform these essential functions can be impaired. This leads to an accumulation of toxins and poor energy management within the body, resulting in severe and persistent fatigue. Additionally, the metabolic stress caused by the body's attempt to compensate for inefficient liver function can consume even more energy, exacerbating the sensation of tiredness. Differentiating common fatigue from fatigue associated with liver conditions is crucial for proper diagnosis and treatment. General fatigue can be caused by a variety of temporary factors, such as stress, poor sleep quality, or inadequate nutrition, and generally resolves with rest or lifestyle adjustments. In contrast, fatigue linked to liver problems is more constant and debilitating, not significantly relieved by rest. This fatigue can be accompanied by other symptoms indicative of liver dysfunction, such as jaundice, abdominal swelling, and cognitive changes. Therefore, unexplained and continuous tiredness should be consulted with a doctor, especially if accompanied by other warning signs of liver problems. Liver problems can significantly affect appetite and cause nausea, symptoms that are often underestimated but can indicate serious liver conditions. The liver plays a crucial role in digestion by producing bile, essential for breaking down fats. When there is liver dysfunction, such as in hepatitis, cirrhosis, or bile duct obstruction, the production and excretion of bile can be compromised, leading to digestive difficulties that result in loss of appetite and nausea. Additionally, the accumulation of toxins that should be filtered by the liver can directly stimulate the vomiting center in the brain, increasing the incidence of nausea, a response of the body to increased toxemia. The persistence of nausea and loss of appetite are important warning signs that can indicate serious liver conditions, especially when they occur simultaneously with other symptoms such as jaundice, dark urine, and chronic fatigue. It is vital to pay attention when these symptoms appear together, as they may suggest a rapid deterioration of liver function, necessitating urgent medical intervention. In advanced cases of liver disease, these symptoms can develop into more serious complications such as hepatic encephalopathy, where brain function is affected due to toxin accumulation. Therefore, immediate medical evaluation is crucial when experiencing these symptoms to ensure proper diagnosis and treatment, preventing the advancement of liver diseases and protecting overall health. Liver health is intrinsically linked to blood coagulation, as this organ is responsible for the production of various coagulation factors. When the liver is compromised by conditions such as cirrhosis, hepatitis, or damage caused by excessive alcohol consumption, its ability to synthesize these essential factors is reduced. This results in an increased tendency for bleeding and bruising, even with minor traumas or without apparent cause. These symptoms occur because the blood becomes unable to coagulate properly, an essential process for stopping natural bleeding and injuries in the body. Therefore, the frequent occurrence of bruises or abnormal bleeding can be a warning sign that the liver is not functioning properly. In addition to coagulation factors, the liver also plays a role in regulating the level of platelets in the blood, which are crucial components for clot formation. Liver diseases can lead to splenomegaly, enlarged spleen, which becomes hyperactive and begins to sequester or destroy excess platelets, further exacerbating coagulation problems. The combination of low levels of coagulation factors and platelets can lead to a dangerous clinical condition, where small cuts or bruises result in excessive bleeding. Therefore, it is essential that individuals with these symptoms seek medical evaluation to investigate the possibility of liver disease, allowing for early intervention and proper management to avoid more serious complications. Liver problems can directly influence the size and function of the spleen, a phenomenon often observed in chronic liver conditions such as cirrhosis. The spleen, which acts as part of the lymphatic system and helps in blood filtration, can increase in size in response to stress on the liver, a condition known as splenomegaly. This occurs mainly due to portal hypertension, an increase in blood pressure in the veins that drain blood to the liver, common in advanced liver diseases. When the liver becomes scarred and hardened by diseases such as cirrhosis, it is unable to filter the blood efficiently, causing a buildup of pressure that extends to the spleen, causing this organ to expand. The importance of early diagnosis of changes in spleen size lies in the fact that splenomegaly can be an indicator of serious and often undiagnosed underlying liver conditions. An enlarged spleen not only signals the presence of complications, such as portal hypertension, but it can also lead to other complications, such as a reduction in the number of circulating platelets and white blood cells due to the sequestration and destruction of these cells by the enlarged spleen. These changes can result in an increased risk of infections and bleeding, conditions that can be potentially fatal. Therefore, timely identification and treatment of changes in the spleen are crucial to prevent the progression of liver diseases and mitigate the associated risks, ensuring a better quality of life for patients. Liver failure can have a profound impact on brain functions due to a condition known as hepatic encephalopathy. This complication arises when the damaged liver can no longer adequately remove toxins from the blood, allowing harmful substances, such as ammonia and others, to accumulate in the body. Normally, the liver converts ammonia into urea, which is then eliminated by the body. However, in liver failure, elevated levels of ammonia can cross the blood-brain barrier and interfere with brain functioning. This can impair cognitive functions, resulting in symptoms such as mental confusion, difficulty concentrating, personality changes, and even alterations in the sleep-wake cycle, which significantly affect the individual's quality of life. In addition to cognitive impacts, liver failure can also cause significant mood changes. Patients may experience episodes of irritability, depression, or anxiety, which are often intensified by the stress of dealing with a chronic illness. In advanced stages, these mood changes can become more severe and be accompanied by disorientation and erratic behavior, reflecting a worsening of hepatic encephalopathy. Such symptoms are alarming for both the patient and their caregivers, highlighting the need for regular medical monitoring and proper treatment to control blood toxins and mitigate the effects of the disease on the brain and behavior. As we unravel the mysteries of the liver and its colossal impact on our health and well-being, it becomes clear that the time to act is now. How many of the signs discussed today resonate with your personal experience? And what will you do next, knowing that your liver could be the silent hero or the critical point of your health? The choice is yours, and the next step could change everything.